This is Randy Ringgold, Founder and Chief Technology Officer of VDI Laboratory. In this educational video, I'll be covering an exclusive offering from VDI, the Feline GI Lymphoma Panel, a simple blood test to aid in the differential diagnosis of IBD versus intestinal lymphoma. Now, this is an updated 4-biomarker panel from our previous 2-biomarker panel. Now, the panel is the first multi-biomarker blood test for the differential diagnosis and monitoring of feline GI lymphoma. The panel consists of thymidine kinase type 1, haptoglobin, cobalamin, and folate. Now, these markers are integrated into an index we call the neoplasia index to give the veterinarian a quick, non-invasive answer as to whether the patient has GI lymphoma or not. The panel also provides patient-specific dosing for B12 supplementation and graphs B12 versus folate for insight into intestinal disorders. But why a multi-biomarker panel for GI lymphoma? Well, probably the number one reason veterinarians see feline patients is related to GI issues. As we know, older cats typically over 7 years of age, develop inflammatory bowel disease, and left untreated often turns into intestinal LSA. While certainly the gold standard method of diagnosis is full-thickness biopsy, there are many situations where due to the clinical status of the patient or just the wishes of the pet parent, biopsy is not an option. In conjunction with ultrasound, the Feline GI Lymphoma Panel can help the veterinarian differentiate normal cats, perhaps cats with food allergies, from those with IBD to those that have intestinal lymphoma or lymphoma of the thorax. Before we get into the specifics of this panel, how do multi-biomarker tests work? Well, diagnostics is really an exercise in statistics and probability, and by applying multiple independent markers, these statistics get better. Let's start with a hypothetical marker A with 73% accuracy. That's not bad, but it's not fantastic. How can we make it better? We could add another biomarker, B. Now, B has only a 64% accuracy rate. Now, that can't be helpful, can it? But the important aspect is it must be independent. When we bring these two together, overall accuracy improves to 84%. Now we could add a third marker, C. C has an 81% accuracy. And when we bring all these together, overall accuracy improves to 97%. Now, this is just a hypothetical example, but multiple biomarker diagnostic panels are common in human medicine, and VDI is bringing this to veterinarians. The panel starts with two important biomarkers. The first is thymidine kinase type 1, or TK1. TK1 is a measure of rapid, abnormal cellular proliferation, which is a hallmark of cancer. TK got its start in non-Hodgkin's lymphoma. Haptoglobin, or HPT, is a measure of systemic inflammation. Cancer being an inflammatory disease produces inflammation. These are independent markers for lymphoma. Then we add B12 and folate, in addition to age, and together develop an advanced biomarker panel specifically for feline GI lymphoma. There are two important reasons to add B12 and folate. One, LSA often damages the intestinal lining and produces deficiencies. And two, B12 and folate are keenly involved in nucleic acid synthesis in what we call de novo, or new nucleic acid synthesis, whereas TK1 is involved in the salvage pathway, or DNA reclamation of incomplete cell cycle growth seen in cancer. But in situations where there is a B12 deficiency, the de novo pathway is interrupted and is often called the folate trap and upregulates TK1. Now, by combining these markers, it helps to balance the effects of opposing forces. The resulting benefit is a ROC curve with good rule-in and rule-out zones. Additionally, these markers provide a disease signature. Now, while it's not definitive, in conjunction with an ultrasound provides non-invasive insight into the type of disease present. This results in improved separation from our previous 2-biomarker panel. Large cell and LSA of the thorax are well separated from IBD cases. Small cell, the most challenging for sure, has improved median separation from inflammatory bowel disease. The report shows how the biomarkers link up to our neoplasia index. The index is a unitless statistical integration of these independent biomarkers. The report will explain what the results mean. Further, if the patient is being treated with corticosteroids at the time of testing, it will compensate for its anti-inflammatory and anti-proliferative effect. Now, for the best results, it is always best to test on an untreated cat. In this report, it indicates it is a high positive consistent with LSA and calls out the profile that aligns with large cell lymphoma. The B12 folate report not only provides values, but VDI provides patient-specific dosing for B12 supplementation. We even graph B12 versus folate. That relationship is valuable. B12 is a dietary source, folate mostly from endogenous bacteria, and both absorbed from different sections of the small intestine, can give the veterinarian clues about GI issues even in the non-lymphoma cat. In this example, this patient's results were inconsistent with lymphoma and consistent with inflammatory bowel disease. A common IBD profile is a normal TK1, mild inflammation, and depressed or normal B12 levels. Lastly, sometimes there's a level of uncertainty. This can happen when there are elevations of TK1 with a depression of haptoglobin, the marker of inflammation. Now, inflammation is expected in both lymphoma and IBD, but when haptoglobin is depressed, there can be other disease processes going on. However, VDI is committed to providing answers. Therefore, in situations where an equivocal occurs, VDI offers guidance on things to look for and a free retest in a 3 to 4 week window to help resolve these more diagnostically challenging cases. I hope this educational video has been helpful to you. For more information on this panel or other services from VDI, please visit us at vdilab.com or give us a call.